Hi there, I'm Dr. Brigid Norton. You can call me Brigid. This is Menopause Bytes, where I unravel the mysteries of menopause for you in bite-sized episodes. Today, let's talk about menopausal hormone therapy and who can't take it. For most healthy women, the benefits of hormone therapy outweigh the risks, but it's not the right choice for everyone. So who shouldn't take menopausal hormone therapy? Well, there are four main groups: those with clotting issues, some hormonal cancers, heart disease, as well as active liver disease. There are also some other issues that might make us pause. For instance, starting hormone therapy late in menopause is generally not recommended. If you have any unexplained bleeding in menopause or unusual bleeding in perimenopause, we should check that out before we start hormone therapy. And there are certain rare conditions like porphyria that could affect whether menopausal hormone therapy is safe. It's all about taking a closer look at your unique situation and figuring out what's best for you. So let's get into more detail. First, let's talk timing. Hormone therapy is most effective and safest when started early in menopause. If you are healthy and within 10 years of your last period, and/or you are under the age of 60, menopausal hormone therapy is likely a good option for you. Unfortunately, many women miss this window. For years, misinformation made menopausal hormone therapy seem riskier than it actually is, so many women avoided taking it. Now they're learning about its benefits and wondering if it's too late. The hard truth: starting menopausal hormone therapy late can increase your risk of heart disease, stroke, and blood clot, so a late start is usually not advised. What about if you have clotting issues? If you have a history of stroke, blood clot, pulmonary embolism, or a clotting disorder, menopausal hormone therapy is generally not recommended because it can further increase your risk of stroke and blood clot. While there might be some flexibility depending on your specific situation, the general rule is that hormone therapy isn't an option for those with these conditions because the outcome can be so devastating. What about if you have a history of hormonal cancers? Generally, the recommendation is that if you have a history of cancers like breast or uterine cancer, menopausal hormone therapy is not advised. However, if you had a very early stage uterine cancer that was fully treated, hormone therapy could be an option. For later stage uterine and breast cancer, we would only consider menopausal hormone therapy if your menopausal symptoms are severely impacting your quality of life and other non-hormonal treatments haven't worked for you. Another group that should not take hormone therapy includes those with heart disease, specifically coronary artery disease, the type that leads to heart attacks. This actually also applies if you have a heart condition that raises your risk of developing blood clots, especially if you need to be on a blood thinner. Liver disease is also considered a contraindication to menopausal hormone therapy. Now, there are a lot of different conditions that fall under this umbrella term, and in some cases, like mild fatty liver disease, you probably can take hormone therapy. However, if you have active liver disease, which usually means that your liver is not working well, then hormone therapy is not recommended. Okay, so we've just gone over the conditions where menopausal hormone therapy isn't recommended. But let's be real, it's not always black and white. If you are really struggling with severe menopausal symptoms and haven't found relief from those non-hormonal options, hormone therapy could possibly be considered. In these types of situations, I make sure my patient fully understands the risks. I always consult with her specialist team, whether it's an oncologist, a cardiologist, or another expert, and together we review the situation, weigh the options, and come to a consensus. At the end of the day, I always remind my patients, I'm the guide and you're the decision maker. Only you can decide what risks you're willing to take for the quality of life that you want. So that's it for another episode of Menopause Bytes. Here are some take-home bites to remember. Menopausal hormone therapy is a safe and effective option for many women, but some conditions make it unsuitable. Women with clotting issues, certain hormonal cancers, heart disease, active liver disease, or those starting late may not be candidates for menopausal hormone therapy. For some, exceptions may apply. Talk with your provider and involve specialists if needed to explore your options. Until next time, may your hot flashes be bearable, your nights restful, and may your journey be filled with grace.